My name is Professor Graham Collins. I'm a haematology consultant and associate professor of haematology in Oxford in the UK. So when I was studying for A-levels all those years ago, I really enjoyed science, and also I was very impressed with how scientific techniques could be applied for the benefit of health. And that really impressed me that we could apply this scientific knowledge to improve people's lives. And that's really why I became a doctor. So I chose to become a haematologist because it really offered a career with a number of things that particularly interested me. So one is I was very interested in the biology of cancer, which is a fascinating condition. I was also very interested in the biology of the immune system, and hematology really treats a lot of disorders of cancer of the immune system. But also I really like dealing with patients on a longer term basis, so forming a proper relationship with patients as they had their diagnosis and then following them through for their treatments and their after treatment care. And that continuity of care is something that's very rewarding within hematology as a specialty. I find many things rewarding about my job. Probably one of the most important things that I enjoy is if a patient comes to clinic and they've been given a diagnosis of, let's say, lymphoma, they can quite understandably be very anxious, very concerned. But actually, when we sit down and have a consultation and we explain the diagnosis, we explain what's involved in treatment, that it's a well-trodden pathway, and that actually many of the diseases that we treat we can cure, then patients often leave really much more positive and optimistic and ready to face their treatment pathway. And I find that very rewarding, that the way we can, with information and support, help patients really get to grips with their diagnosis. I think what my patients value most about me is that I am very interested in lymphoma as a condition. And I often say to people that you want a doctor who is interested in their condition. It sometimes sounds a little bit odd, oh yes, what you've got is really fascinating. But actually, if your doctor isn't interested in the condition you have, then they're probably not worth having as your doctor. So I think that's one of the things they value. And also, I think communication skills. I do spend quite a lot of time with patients, making sure they understand the nature of their condition and the nature of their treatment. I think that's really important for them to have a better experience as they go through what is always a challenging time. What I appreciate from my patients, again, I think I'd circle back and talk about the continuity of relationship. So getting to know patients, getting to know their families, getting to know their likes and dislikes, what I also appreciate is just the variety of life that we see walk through the door in a clinic. People from all walks of life, all ages, all stages, really adds to the interest and challenge of the job. Yeah, so I think that the mantra that I would often teach my trainees is always be willing to learn. So no matter how old you are as a clinician, there are always new things to learn and to get your head around and to digest, always new data in conferences to apply to your patients. And I think the other thing I would also say is be willing specifically to learn from your patients. It's amazing how many new side effects of treatment that I come across that I've never come across before. So I think just having that openness to learn new data, but also from our patients, I think is absolutely key.